Ever wondered what enlarged prostate or benign prostate hyperplasia is? Well, let's peel back the layers and delve into this topic. The prostate is a small gland that is part of the male reproductive system. It's about the size and shape of a walnut and sits just below the bladder, surrounding the urethra, the tube that carries urine from the bladder out of the body. As men age, it's common for the prostate to grow larger. When this growth is non-cancerous, it's referred to as benign prostate hyperplasia, or BPH for short. Now, this isn't some rare, unheard-of condition. Quite the contrary, it's a common part of aging for many men. In fact, it's so common that it's estimated that by the age of 60, half of all men have some degree of prostate enlargement, and by the age of 85, that number increases to about 90%. But just because it's common, doesn't mean it's insignificant. BPH can lead to a variety of symptoms that can significantly impact a man's quality of life. These can range from frequent urination, especially at night, to difficulty starting and stopping urination, and even urinary tract infections or kidney problems in severe cases. Now, it's important to underline that having an enlarged prostate does not mean you have prostate cancer. The two are separate conditions, and one does not lead to the other. But it's also crucial to get regular checkups, as early detection of any prostate issues can lead to more effective management and treatment. Furthermore, while BPH is not preventable, there are lifestyle changes that can help manage the symptoms. These include maintaining a healthy weight, staying physically active, and following a diet rich in fruits, vegetables, and lean proteins. Understanding BPH is the first step towards effective management and prevention. In the following scenes, we will explore the causes, dangers, preventive measures, and foods beneficial for individuals with BPH. So, stick around and let's continue this journey to better health and well-being together. Now, you might be asking, what causes this condition? Well, let's dive right in and explore the primary factors leading to the development of an enlarged prostate or benign prostate hyperplasia, BPH for short. The first and most significant factor is age. Yes, the clock indeed plays a pivotal role here. As men age, the prostate gland naturally tends to increase in size. It's a part of the aging process. While this growth is typically slow and gradual, by the time a man reaches his 60s, the chances of developing BPH significantly increase. By the age of 80, nearly 90% of men will have BPH. So, it's not a question of if, but when. Now, let's talk about hormones. They're the body's chemical messengers, controlling a wide array of biological functions, including the growth of the prostate gland. Specifically, two hormones play a leading role in the development of BPH, testosterone and estrogen. Testosterone, the primary male hormone, is converted into a potent form called dihydrotestosterone or DHT in the prostate cells. DHT stimulates the growth of prostate cells, leading to an enlarged prostate. On the other hand, estrogen, typically associated with females, also exists in small amounts in men. As men age, the proportion of estrogen to testosterone increases, which may stimulate further growth of the prostate gland. Interestingly, not all men with high levels of these hormones develop BPH, suggesting that other factors, possibly genetic or environmental, may also play a part. However, research in these areas is still ongoing, so there you have it. Age and hormones are the two key players in the development of BPH. It's a natural process, but one that can cause a lot of discomfort and complications if it goes unchecked. Knowing the causes of BPH can help us take proactive steps towards prevention. Indeed, understanding the root causes empowers us to make informed decisions about our health and well-being. So stay tuned as we delve into the dangers of BPH in our next segment, and later, we'll discuss ways to prevent this common condition. So, how dangerous can an enlarged prostate get? Well, the answer is, quite perilous indeed. Benign prostate hyperplasia or BPH is not something to be taken lightly. It can lead to a host of complications, particularly concerning the urinary system, given the prostate's role in male reproductive and urinary health. One of the more immediate dangers is urinary problems. When the prostate enlarges, it squeezes the urethra, the tube that carries urine from the bladder out of the body. This can lead to symptoms like frequent urination, difficulty starting or stopping urination, weak urine flow, and the sensation of not fully emptying your bladder. But these are more than just inconvenient. They can seriously impact quality of life and sleep patterns, leading to fatigue and reduced productivity. Now, if left untreated, these urinary problems can escalate to bladder damage. The bladder is a muscle, and if it's continually strained by trying to push urine through a narrowed urethra, it can become weak over time. In severe cases, the bladder can no longer contract properly, making it difficult to fully empty it. This can lead to urinary retention, a condition where you're unable to urinate, which is not only painful but can also lead to urinary tract infections. And it doesn't stop there. The kidneys too can be affected by an enlarged prostate. If urine backs up into the kidneys due to bladder dysfunction, it can lead to kidney damage or even kidney failure, which is a life-threatening condition requiring immediate medical attention. But it's not all doom and gloom. The good news is these dangers are preventable with early detection and treatment. By being proactive about your prostate health, you can avoid these complications and maintain a high quality of life. So it's clear that BPH is not a condition to be ignored. It's a serious health issue that can lead to severe complications if left untreated. But with early detection and appropriate treatment, you can avoid these dangers and live a healthy, full life. The dangers of BPH highlight the importance of early detection and treatment. You might be wondering, how can we prevent BPH? Well, the good news is that there are several ways to potentially keep this condition at bay, or at least slow its progression. Firstly, regular checkups are crucial. You see, BPH doesn't typically spring up overnight. It's a gradual process that comes on with age. So, having routine medical exams can help catch any early signs of an enlarged prostate. This means your doctor can start you on a suitable treatment plan sooner rather than later. Next, maintaining a healthy weight is another key prevention method. Excess weight, particularly around the abdomen, can put extra pressure on the bladder and the urethra. This can exacerbate symptoms of BPH and even speed up its progress, so try to keep those extra pounds off. Incorporate a balanced diet and regular physical activity into your lifestyle. It doesn't have to be anything too strenuous. Even a brisk walk a few times a week can do wonders for your health. Another prevention method is regular exercise. Not only does it help maintain a healthy weight, but it also improves overall body function, including that of the prostate. Exercise increases blood flow to all parts of the body, ensuring that your organs, including the prostate, receive enough oxygen and nutrients. And here's a little bonus tip. Try pelvic floor exercises. Yes, men can do them too. They strengthen the muscles that control urination, which can be beneficial in managing BPH symptoms. It's also important to avoid or limit certain things like alcohol and caffeine. These can stimulate urine production and irritate the bladder, worsening BPH symptoms. Lastly, don't forget to stay hydrated. It might seem counterintuitive, especially if you're already dealing with frequent urination. But dehydration can irritate your urinary tract and exacerbate BPH symptoms. So, drink plenty of water, but spread it out evenly throughout the day. Prevention is always better than cure, especially for conditions like BPH. So, take these prevention methods to heart and make them a part of your daily routine. Your prostate will thank you for it. Did you know that your diet can influence your prostate health? It might seem surprising, but what you put on your plate can have an impact on your prostate. Let's delve into the various foods that can help prevent benign prostate hyperplasia or delay its onset. Fruits and vegetables should be your go-to foods. They are packed with vitamins, minerals, and antioxidants that can help protect your prostate. Cruciferous vegetables like broccoli, Brussels sprouts, and cabbage have been linked to a lower risk of BPH. Citrus fruits, rich in vitamin C, also play a crucial role. And let's not forget about tomatoes. They contain a powerful antioxidant, lycopene, which can help prevent prostate diseases. Next, let's talk about omega-3 fatty acids. These healthy fats, found in fish like salmon, mackerel, and sardines, have anti-inflammatory properties and are known for their potential to reduce the risk of BPH. So consider adding a serving of fatty fish to your menu at least twice a week. Soy foods like tofu and edamame are also beneficial. They contain isoflavones, compounds that have been associated with a lower risk of prostate enlargement. And have you heard about the benefits of green tea? It's not just a soothing drink. Green tea contains catechins, antioxidants that can help fight off prostate issues. So, next time you're reaching for a drink, consider a cup of green tea. Finally, the power of seeds should not be underestimated. Pumpkin seeds and flax seeds are rich in beta-sitosterol, a plant compound that can help reduce the symptoms of BPH. But remember, while these foods can contribute to your prostate health, they are not a cure-all. It's crucial to maintain a balanced diet, exercise regularly, and have regular checkups with your doctor. Remember, a healthy diet is a cornerstone of overall health and can help keep BPH at bay. So, keep these foods in mind the next time you're planning your meals. Your prostate will thank you. In conclusion, understanding enlarged prostate or benign prostate hyperplasia is crucial for every man. We've learned that this condition is common, but with awareness of its causes and dangers, it can be managed effectively. The importance of prevention can't be overstated, and luckily, there are many foods that can help in this regard. So let's all take care of our health, make wise dietary choices, and keep this conversation going. Stay informed, stay healthy, and always remember that knowledge is power when it comes to your health.